impacted by staffing shortages, and you may have personally noticed in terms of your ability to get in or how long you have to wait for an appointment. It is noticeable, and it's been tough. Across the health system, the hardest hit areas are nursing, respiratory care, and blood draw. At Lee Health, we are over budget by a lot in terms of our premium labor. So what we've had to do is resort to temp contracts, nursing travelers, a lot, even imaging tech travelers, and they're very expensive. We've paid a lot of incentives out to our own employees to try to encourage them to work overtime. We've had incentives as high as paying an extra $65 an hour on top of overtime pay. So it's been that extreme in what we've had to do to keep the hospital staffed. At Lee Health Coconut Point specifically, what we're seeing is effects in primary care, the lab draw, and the rehab services. That's where you'll notice it the most. It really has not impacted our emergency room experience much because it's a major priority for us. And we've invested in what we need in terms of the traveling contracts. Okay, let's get to the good stuff you've been waiting for. What's the plan for a 24-hour hospital? So if you don't know already, Lee Health Coconut Point was built with the ability to add on a hospital tower. That hospital tower could be as much as 5 floors, which would translate to 80 to 100 beds, depending on how you wanted to split them up or what kind of beds they would be. We have a central energy plant on the campus already that can support that. About 10% of the original budget was dedicated towards making it a quick, easy build for that hospital tower. We do acknowledge there is major population growth here. That said, we don't have imminent plans to add that tower right now. We know it's there, we know it's available. When we do expand beds, that'll be the first place we're looking. We just don't have plans to do that right now. So in the absence of that, this is where I want to talk about the observation unit a little bit. Our goal in the absence of that hospital is to get creative, get innovative. How can we keep you in the community here and avoid those transfers? So the observation unit has been a major part of that. This year, and we are on pace since October 1st to do about 650 to 800 overnight stays. We've done about 450 so far, and every month that number's going up. So what this means is you come to the emergency room. These are all patients that would have otherwise been transferred. Okay? If it's something that we can care for you for, keep you local, we will keep you local. Technically, the observation unit is outpatient. You are not admitted to one of the campuses when you stay overnight at Lee Health Coconut Point. Our observation unit is 9 beds. Each room has its own bathroom. They're all private rooms. And the way that is staffed is we have a physician assistant on site. This physician assistant is part of the hospitalist team at our campus. So you have remote access to the physician. His assistant is on site caring for you, writing the orders, eyes on you. Very rare occasions we've had the hospital internist drive down here to assess a patient. It's happened, but that's rare. It is, and here's where we've had to get creative. Even though you are not admitted to the hospital, the physician providing your care in that OBS unit is at the hospital and providing that care to patients that are admitted. Right? So that's how we're set up. While you're there, we do have consults available via neuro and cardiology, and those are remote. So the scope of service that we have there, the majority of the patients that are getting admitted to observation here are chest pain patients. Okay? So when they get admitted, typically a chest pain patient, I shouldn't say admitted, that was a bad word. When they get transferred from the emergency room to observation, the care transitions from the emergency room physician to that acute hospital internist. You are no longer in the emergency room. The emergency room is no longer responsible for you. You're in a new unit at this point. Then you have access to all the ancillaries, which you don't have access to all the ancillaries in the emergency room. Things we don't do in the emergency room: echocardiograms. We don't do stress tests. We typically don't do coronary CTAs, which is basically a new way of giving you a cardiac catheterization. We can do it via imaging now. All of those things can happen in the observation unit. We expect to go from 800 this year to probably 1,500 next year. So what the way that you should look at that is that's 1,500 patients that would have otherwise transferred north or south that are now staying here. Okay? So that's really our main strategy right now as we lead up to whenever we end up building that hospital. And we're going to continue getting creative, figuring out ways how to keep people from having to travel for that care. The next thing that we're thinking is something along the lines of what we call a complex care center, which one of the main functions of that is infusions and also diuresis, which right now people will have to travel for. All right. Future plans in Estero. You had a good intro for me there, Mary. Thank you. So we have the University Highlands Center. She showed a picture of it in the last presentation. I think we started building that now. I haven't driven past it lately, but it's starting to go up. What is going to be in there? Primary care physicians will be in there. Rehabilitation will be in there. Physical therapy, occupational therapy. We probably will not start with speech therapy, but we could expand to speech therapy. X-ray, mammography, and a lab draw site. The mammography will be screening only. So if you do end up with an abnormal result, you'll get a more intensive diagnostic. We won't be doing that in that building. That requires a radiologist on site, and we don't plan to have a radiologist on site in that building. We do at Coconut Point. Other buildings that we own, we have that Tijuana Flats building. There's a name for that little area, and I forget what it is. Current tenants are Sheriff's Office and Tijuana Flats. We don't have anything planned imminently for that, but same thing, there's a lot right next to that we own as well. No imminent plans. And then if you've driven to Coconut Point, you know that big field in between the building and Coconut Road. The thought there is future medical office expansion, but we don't have anything planned imminently for that. As the needs arise, we will talk about that. Right now, the main thing we're focusing on is Bonita Health Center. There is a lot of work happening at Bonita Health Center right now. Bonita Health Center is right behind us, but it's front row on US 41. That was originally a joint venture between Lee Health and Naples Community, and we recently acquired their 50%, so it's fully owned by Lee Health now. When that was a joint venture, it was independently operated. It was its own entity. It was Bonita Community Health Center. We call it Bonita Health Center now. And the employees were employees of Bonita Community Health Center. And when I'm talking about those employees, I'm talking about the urgent care there, the imaging,